Hello, I'm Dr. Aruna Muralidhar, a senior consultant at Fortis La Femme Hospital, Bangalore and Shri Clinic at Jayanagar. I'd like to talk about adolescent health in this video. When we say adolescents, the WHO defines adolescence as the years between 9 and 19 years of age. So it is extremely, as you can tell, it's an extremely important phase of one's life. This is a time when there are so many physical, emotional, and social changes happening in the little one's mind. It is a transition phase wherein a child slowly transitions into an adult. So there's so much of turmoil in the mind wherein there's a change from thinking to abstract thinking. There's sort of concrete thinking, abstract thinking change. And there's also so much of influence of various people such as peers, media, advertisements, teachers, mentors, etc. on the pliable minds. This is known as a transition phase for various reasons. Not only because of all these changes happening in one's sort of physical, mental, and emotional levels, but also because a person is trying to venture into the world outside and trying to understand where he or she belongs and what his or her identity is in this world. I would say adolescence is like Trishanku Swarga, where a person wouldn't know whether he is a child or he is already an adult. And many of them assume that they're adults, and this is what makes them prone for various risk-taking behaviors and mental health issues as well. I'd like to focus on certain important aspects of adolescence because this, for us healthcare professionals, is a window of opportunity to actually intervene and make them healthy, productive individuals with a long, productive life ahead of them. We have had a window of opportunity as they were children. We have had the window of opportunity when they were in their mother's wombs. Now, this window of opportunity is before they grow into complete adults. And we should not lose this window of opportunity to intervene and make sure that many of the lifestyle disorders, which unfortunately have their grassroots in this phase of life, do not occur. Lifestyle disorders such as diabetes, hypertension, hypercholesterolemia, obesity, and mental health issues, many other endocrinological problems, etc., actually have their, the roots in this phase. And if we can recognize the early warning signs, we can do a big deal in terms of avoiding it in the future. Adolescents are those people who do not actually communicate very freely. So as parents, we have the responsibility of giving them a safe, secure, communicative, open environment in which they feel cared for and very comfortable in actually communicating their feelings. Yes, there is a phase when they feel peers are more important than their parents, but that is a natural phase and we shouldn't avoid that from happening. But even in that phase, if we can have time and place for open communication, it makes our job so easy, and even for them, they feel cared for. In terms of adolescent health issues, we know that there are so many problems which actually happen in those who have certain risks in their lives. Risk factors are known to be associated with those who have a higher issues with their health. And these risk factors are a very poor family situation wherein there is marital discord, exposure to disrespectful ways, exposure to various temptations, and parents showing their lack of control in terms of substance abuse, having no restraints about media use, about internet use, and advertisements and the temptations that come thereon. And also in terms of them wanting, they have a desire for quick gratification and immediate results. Many a times, these are the main harbingers of problems in terms of mental health problems and substance abuse. If they're provided with a calm, caring environment where there is respect for each other and there are certain ground rules about the use of media, use of VDUs, etc. And there is also some sort of safety rules in terms of parental controls on media, etc. And also controls in terms of the timing, the usage in terms of hours. Also, tools such as habit trackers, which help them mold their day according to the schedule that they have ahead of them. Plus regularity in terms of eating, regularity in terms of sleeping habits, and regularity in terms of various other schedules of the day would take them a long way in preventing all sorts of health problems in the future. Habit forming happens during these years, and the habits which are formed during these years are here to stay forever. Some of the problems as a gynecologist and adolescent health specialist, some of the problems that I see adolescents for are issues with irregularities in periods, such as PCOS, issues with weight gain or weight loss, issues with eating disorders, endocrinological problems such as thyroid issues, anemia for various reasons, substance abuse, sexual problems and teenage pregnancies, sexually transmitted infections, unwanted pregnancies and terminations, and also in terms of other problems such as early onset, diabetes, etc. As far as an adolescent health service is concerned, it is very important for us as parents, as teachers, as a society at large, to understand that these adolescents, they apparently look healthy, they think they're healthy, they act healthy, but these are the times when they may actually be brewing a situation which may lead on to a lifestyle issue later. So it is important for us to be vigilant about certain warning signs, certain soft signs, and in terms of both physical and mental health. And it's important for us to intervene and take them to an adolescent health specialist who would be able to evaluate them completely in a comprehensive manner, in a service which is accessible, confidential, non-judgmental, and open in its empathetic in its approach, and have a comprehensive set of services such as gynecologist, a pediatric adolescent specialist, and a pediatric endocrinologist, a nutritionist, exercise therapist or physical training therapist, as well as a dermatologist sometimes, plus very importantly supported by psychologists or psychiatrists. So adolescent health services are an extremely important part of our healthcare armamentarium, so that we do not lose this window of opportunity to intervene at the right time and make sure that our adolescents, who are a powerhouse of our future, achieve their full potential during their life. Thank you very much.